We have you here today because we want to continue raising awareness on COVID-19 and get an insight into what's exactly happening in the nation. So let's go right into it, Doctor. Starting off this interview, I'd like to discuss some numbers with you. Today, we're at more than 28 million cases in this country with at least 514,000 deaths. In the world, we are at 114 million cases with at least 2.5 million deaths. My first question to you is, we keep on hearing that there's a downward trajectory of cases and deaths going on. However, the numbers are so large. How do you look at it?
So I think it is important to keep that perspective. Yes, overall numbers are down compared to COVID 1.0, if you say the first wave. But recently, if you've seen in Northeast, we've continued to see our numbers fluctuate. It varies in different times. It also varies with different events. So if there have been large gatherings or holidays, we do tend to see a bit of a spike. Recently, I think here, definitely in the Northeast, we haven't seen the numbers trending down as we would like to see them by now going
even more. So when you are looking at these numbers, Doctor, are you at all concerned about a fourth surge of COVID-19? We're hearing about these variants from the UK, South Africa, New York has its own now. How much of that is going to impact these case numbers and deaths?
So I think we are always worried about the next surge. I think the most important thing I would say is being very vigilant, even if you are vaccinated, to make sure that you don't gather in large crowds. You continue to have physical distancing, wear your masks, hand washing, cleaning your surfaces very diligently. I think those are really crucial. The variants have always been there. We are much more cognizant of them, especially the New York one. I think the infectivity rate is higher, so your likelihood of getting it is higher. So the goal really is to make sure that we continue to stay vigilant, we continue to comply with CDC guidelines, and to make sure that we keep ourselves and the folks around us safe by getting vaccinated.
Doctor, what exactly are these virus variants doing to the virus itself, and what is it doing to the body?
I think it's the variants. What they do is the efficacy of the vaccinations definitely get affected, but at the same time, the variants are very similar to as we see in flu, correct? That you can have different types of the flu variant. So if you've been exposed to one, doesn't mean you might not get infected to the other one. So it continues to challenge your immune system, but at the same time, it also tells you that just because you have had COVID in the past doesn't mean you might not get COVID again, and your immune system might have not seen this particular variant. So I think that's an important thing to remember, that it is always mutating and evolving, and we need to make sure that we continue to keep our vigilance.
In the next coming months, come spring, Doctor, are you seeing these variants impact the trajectory that's going downwards right now? When do you see it become the most prominent right now?
You mean the
variants? When would they really impact us?
I think the variants are very much already evolving and mutating. We saw them in March, we saw them in the fall, and we continue to see them in the winter months. I think the goal is going to be really making sure that everybody gets vaccinated, irrespective of which vaccine we take, in order to keep ourselves, and again, as I said, the folks around you safe. And it's going to really depend on how we are responsible when we are in the community and we are outside, that we continue to maintain our vigilance and masking and keeping our physical distance.
Right. Experts are also saying, Doctor, that age groups of 20 to 46 might be responsible for the ongoing surge in cases that we're seeing in some states. And in general, too, they're saying that one age group is very crucial right now. What are your comments on that?
I think that is the age group that the likelihood of having asymptomatic shedding, as we call them, is that they might not show all the symptoms of COVID, but they can continue to transmit it. I think that's also the group that likelihood of socializing and colleges and gathering in crowds. I think that is another reason. But it is important to remember that it could be any age group. It could be anyone that could be shedding without realizing that they even have COVID. So irrespective of the age group, COVID doesn't differentiate between age, doesn't differentiate between genders. I think it is each of our responsibility to make sure that we curtail this.
Yes, for sure. Let's talk about the vaccines, doctor. I have a lot of questions in regards to that. The first question is, how have you observed Moderna and Pfizer vaccine, and have you seen any differences in side effects from both the vaccines?
I think both of them have a similar side effect symptoms. Either it's local reaction or fatigue or fever or body ache. Not seen much of a difference between both of them in the reactivity. Very similar patterns, both for Moderna and Pfizer. Yeah.
Yeah. And is there any difference between the mechanisms of the vaccines at all?
So I think both the vaccines, Moderna and Pfizer, work on the mRNA. The J&J works a little different. It's a vector variant, slightly different, but majority of them are really targeted towards curtailing COVID and your likelihood of getting infection. And efficacy, as we all know, for Moderna and Pfizer is in the 95th percent, but for J&J, it's slightly lower, but I would say with J&J, it is more efficacy or efficacious for folks that have severe disease of COVID and hospitalized patients. So that definitely is promising.
Just talking about Johnson & Johnson, I was just getting there. It has 66% efficacy against moderate to severe and 85% efficacy in most severe diseases. This vaccine has been called a game changer because as of today, it has been authorized for use. It's going to be administered this week. Is there going to be a huge difference in immunity between Moderna, Pfizer, and Johnson & Johnson? Some people are worried about taking Johnson & Johnson because of the efficacy. What do you say to that?
So my request to everybody is take the vaccine, irrespective of which one you take. The efficacy is always better than zero, right? If we take the flu shots, the flu vaccine efficacy is in that lower 50 to 60%, depending on the variant. But the most important thing is getting any of the vaccines. And remember that J&J does have a higher efficacy when it is moderate to severe disease and also for the hospitalized patients. So you can't go wrong. And I think it's a way to pay forward to create that herd immunity.
And J&J is studying a 2-dose regimen right now, doctor. Why do you think they're doing so? Is it because they want to produce booster shots for these variants?
I think most of the second shots are meant to be booster shots. I think the data and the science behind it will tell us why they are trending towards that. But so far, they have shown that the single shot can have the same efficacy as the dual shots, especially for the hospitalized patient, though it's in the 85%, but that's pretty impressive.
Right. Let's talk about AstraZeneca, doctor. The vaccine has been approved by the World Health Organization, but was stopped by South Africa due to the South African variant. It has not been approved in the United States yet. How are you looking at AstraZeneca? Do you have any insight into it?
Not much insight, except what the CDC has commented on it. I think AstraZeneca has some advantages on the storage and ability, to be able to be given in areas maybe where there is less ability and access or storage facilities. So that's where AstraZeneca has really been efficacious globally.
What do you think is currently missing in the vaccine research, doctor?
I think it's the research piece that needs to continue and data over the next year to 2 years to show us how these vaccines create herd immunity and individual immunity and how long do they last and what is going to be the various different efficacies as we go through this journey of COVID. COVID is here to stay. It is the new norm. I think data and science is going to be critical, and I'm excited that we have the research and the data and the science coming along, as we all know that these studies are continuing as we speak.
For sure. I have more questions on vaccine, doctors. We are hearing that the immunity currently lasts about up to 90 days. In some papers, we have read that. What do you have to say about that? How long is this immunity actually going to last?
I think, again, this is ongoing evidence and it's always a fluid situation. I think 90 days is a safe number that we bank our hats on, that your likelihood of getting infections within that 90 days is less. And that is in respect if you continue to do follow the rest of the guidelines. So that's the reason why it is 90 days, either post-COVID infection or a post-vaccination.
And doctor, once you're vaccinated, for a lot of the population that has been vaccinated, what can they do after being vaccinated? Can grandparents visit their grandchildren? How much do you have to mask up? How are you looking at that?
So I think the most dangerous pitfall is false security. Just because you've got the vaccination doesn't prevent you from getting the infection. As we say, efficacy is 95%, but there is that chance. So I think it's very important to be responsible in a sense that if you are visiting family that has comorbid conditions or are prone to get sick, you have to be extra careful. You have to make sure you wear your masks. And as we know, CDC also has new guidelines of double masking, but making sure you wash your hands, you keep your physical distance. And I think that cannot replace any of science or the vaccinations, right? I mean, these are the things that have been trusted, proven, and retested, and we know that that does work.
Right. On the vaccination program, doctor, there has been a huge debate in the nation about educators and teachers getting vaccinated. The CDC has come out and said that it's safe to open schools even without the teachers and educators getting vaccinated. Could you explain to us why they might have come up with this suggestion, and also how important do you think it is for these teachers to be vaccinated?
I think this is a very personal choice. I think as long as we keep vaccinating the more people, the better it is. Of course, the school educators are very crucial. So our, different school districts, I think that is an individual decision that needs to be made by, I would say, the school system, the educators, and the community, depending on what the schools have and what abilities they have for, having a great filtration system, having adequate physical distancing for education, and making sure that all the rules and regulations and compliance are followed that CDC has outlined very clearly.
Right. Dr. Tank, a lot of South Asians currently are at high risk. The population is generally at high risk due to cardiac issues, diabetes, high cholesterol, blood pressure, you name it. Have you seen any relation between COVID-19 and these at high risk patients? Are they actually at high risk for having this disease?
So I think South Asians have higher comorbidities, as we know, higher, more prevalence of family history, more prevalence of cardiac disease. I think irrespective of where you are from, if you have comorbid conditions such as, diabetes, hypertension, coronary artery disease, or even some form of respiratory comorbidities, you are at a high risk. And especially with South Asians, when you know that you have a higher prevalence of these diseases, your risk of COVID-19 is pretty high.
Right. I just have a couple more questions left for you, Doctor. Dr. Anthony Fauci, nation's leading expert on coronavirus, said that Americans may be wearing masks up until 2022. Do you think that will happen?
Difficult to predict the future, but absolutely letting everybody know that I don't think masking is going away. And if we are to fight this pandemic to our utmost potential, I think masking is going to be very critical for us.
Right. How are you looking at domestic travel and COVID-19? Do you think maybe vaccines should be required for that purpose?
I think any travel is going to be very cautious about if you've been vaccinated or not vaccinated. I would prefer everybody does get vaccinated. You have to be extra cautious and careful because as we all know that there are different variants in different places. And just even if you've had COVID doesn't mean you are immune to it. So you have to have that continuous vigilance irrespective of where you travel.
Right. I only have 2 more questions left for you. This might be a little personal, Doctor. You are the Chief Medical Officer, and I know you have seen COVID from day one. How has that experience been for you? And what have you learned the most out of it?
It'll be a year, March 4th, since we had our first COVID patient. And it is not easy to be on those front lines. Have been very blessed with a very great and robust team. the most important thing I've learned is the human spirit and the resilience that comes with it, the empathy and the compassion. Because as we went through this navigated COVID, our communities, our patients, our friends, our loved ones, our peers got sick, and unfortunately, we have lost some. But I think we also became families for our patients that came through our front doors, because there was a point where we had no visitation.
Right.
And it continues to impress me, and I stand in awe of all what the community has done and supported us, but also the healthcare teams that have continued to strive to provide the best care to their patients day in and day out.
Yes, for sure. And my last question is, I request you to give a message out to these frontline workers, healthcare workers, people that are, doing essential work. What do you have to say to them?
I think it's a privilege to be one of them, and it's my gratitude for what you all do every single day, and how important it is for you to do what you do every single day, because we as the community and we as healthcare providers rely on you to make sure that we can fight this pandemic successfully. But I think the most important thing is to take a pause and think about your own wellness, and look at your peers as support and guidance also, because it can get pretty lonely. And it can get pretty tough, as we all know, that as you navigate this pandemic all over again. So it is important to be there for each other, to empathize, to be compassionate, but at the same time, encourage each other to continue doing this, because there is a light at the end of the tunnel with the vaccinations and the science that comes through every single day with research and data to continue to fight the pandemic.
Dr. Tang, thank you so much for all that you do and all that your hospital has been doing. Thank you again for your time here on ITV Gold.